Thank you so much for having me today, and thank you for participating. I know how difficult it can be to sit at your computer for hours on end and not get the interaction we're so accustomed to at conferences like this, so thank you. From day one of Governor Holcomb's administration, combating the drug epidemic has been one of his top priorities. And while COVID-19 has shifted our course, our mission remains the same. For those with substance use disorder, COVID-19 has presented itself to be an especially scary time. They say the opposite of addiction is not sobriety, but connection, and it's very easy to have been disconnected over the last 6 months. Consider the following. Indiana's statewide 211 call center previously received approximately 1,100 calls on a busy day. During the COVID-19 stay-at-home order, 211 averaged over 25,000 calls a day, many related to mental health and suicidal thoughts. Our emergency departments have seen a 79% increase in overdose events since this time last year, and we've seen a nearly 63% increase in the administration of Naloxone by EMS. Prior to COVID-19 coming to Indiana, we were on a path that had us reporting stats that we hadn't seen in years. We had seen our overdose deaths decrease at twice the rate of the national average. Opioid prescribing rates were down 70%. And our addiction treatment infrastructure has never been stronger. I think it's safe to say we're in a much different spot than we found ourselves just 6 months ago. But every day, I'm impressed by the level of cooperation and collaboration between our state agencies, not only with how they work with each other, but with our external partners. That collaboration has been instrumental in our response to COVID-19 as a state, as one Indiana. When we started to see naloxone administered by EMS dramatically increase in April, Governor Holcomb dedicated $1 million to fund 25,000 doses of naloxone in partnership with Overdose Lifeline. Already, Overdose Lifeline has distributed more than 5,800 doses of this life-saving medication since the launch of our partnership on May 18th. If you or someone you know is in need of naloxone, please reach out to Overdose Lifeline, and they'll provide you with a supply of the medication. In conjunction with this announcement, Indiana Medicaid has received approval from CMS that allows for full reimbursement for emergency medical responders who administer naloxone. Indiana is the first state in the nation to pay EMS providers for both the administration of the drug and the medication itself. In addition, every offender with a history of substance use disorder will receive a supply of naloxone upon release from the Department of Correction. The COVID-19 pandemic is creating and exacerbating mental health problems and substance use disorders, resulting in an increased need for crisis intervention and resources for psychological well-being. In mid-August, Governor Holcomb announced a partnership between the Indiana Division of Mental Health and Addiction and Mental Health America of Indiana to expand access to peer supports through the Indiana Recovery Network. This will help those with mental health and substance use disorders sustain their recovery through one-on-one connections and relationships. The expansion will result in the addition of at least 40 part and full-time peer recovery specialists at 16 of Indiana's recovery-based organizations. In the first month since announcing this partnership, more than 2,000 Hoosiers have already been served by the recovery hubs. Through this partnership, even Hoosiers in areas lacking resources will gain better access to the recovery supports they need. To address the critical calls coming into our 211 call center, DMHA launched the Be Well Crisis Helpline, where any Hoosier can call and speak with a trained crisis counselor 24/7, free of charge. These trained crisis counselors are able to listen and provide support at a time when individuals are experiencing elevated stress and anxiety. Already, the helpline has been averaging over 200 calls a week since its launch in July. DMHA also opened 3 opioid treatment programs during the COVID-19 shutdown, helping the providers connect with both the DEA and the Indiana Pharmacy Board to help get final approvals while both agencies were closed. This moves us closer to our goal of having every Hoosier within an hour's drive of one of these treatment centers. And the work goes far beyond the state's efforts. Our partner organizations across Indiana's 92 counties have gone virtual to continue providing peer recovery support, community outreach, telemedicine, naloxone, and suicide prevention training. Many groups have worked around the clock over the last several months to expand access to quality care and timely treatment for Indiana's underserved communities. For example, the Affiliated Service Partners of Indiana are using a $2.4 million federal grant to better serve families who are impacted by substance use disorders in underserved areas. Like I said before, COVID-19 shifted our path, but our mission remains the same, and we continue to make progress. We've witnessed a 156% increase in residential treatment beds since Governor Holcomb took office in 2017. And we've expanded medication for opioid use disorder to our 15 community mental health centers, mobile response teams, and county jails, which I'll touch on later. Through a partnership between Open Beds and Indiana 211, more than 1,400 Hoosiers have been referred to treatment via the digital platform. And we recognize the importance of recovery residences, which is why in May, we awarded $25,000 to Dove Recovery House for Women to provide training on evidence-based recovery practices. As we continue to build the treatment infrastructure, we must also grow and expand our recovery infrastructure. That includes increasing the number of recovery houses in this state. Individuals in recovery deserve safe and supportive housing. Now, more than ever, we must come together and wrap our arms around those in need. Take it from Angie Borman of Blanc Consulting, who's been helping the Indiana Affiliation of Recovery Residences lead regional meetings to help people understand how they too can open a recovery residences. All across our state, communities have banded together, creating strong local coalitions that are connecting people to care and attacking the drug epidemic. At the state level, we've been helping fund many of these coalitions and providing technical assistance. About 300 attendees from just under 30 Indiana counties have engaged in regional trainings led by the National Council for Behavioral Health, learning how they can develop their own trauma-informed, recovery-oriented system of care. And 12 of our communities completed the National Council's Transformation Academy trainings. These coalitions have helped to bring mobile response teams to areas that lack treatment capacity and quick response teams to areas that lack follow-up care. We have 20 hospitals with peers in the emergency departments that have engaged over 1,500 patients between February 2018 and April 2020. We know that 63% of those engaged in some type of treatment following their interaction with a peer. We've launched and funded comprehensive addiction recovery centers, helping communities create a hub and spokes approach. Currently, these CARCs exist in 3 Indiana counties, Lake, Marion, and Dearborn. And in May, Allen County was awarded and funded for one of these designations. And our work is being nationally recognized. Earlier this year, the American Legislative Exchange Council named the program a model law for replication across the country. We aren't just trying to tackle the symptoms here in Indiana. We're working head-on to help those suffering the most. With more than 80% of those in the criminal justice system having a diagnosable substance use disorder, this is ground zero for helping people restart. Through our strong partnership with the Supreme Court and the leadership of Chief Justice Rush, we're implementing this sequential intercept model in every county. We're funding startup costs for new drug courts and family courts, and we're addressing underlying mental health issues. At the Department of Correction, we've worked to redesign the way we provide educational credit to inmates so they have more incentive to holistically engage in addiction recovery treatment, mental health management, and vocational development. So they can re-enter our communities, engaged as neighbors, forever removed from the justice system. We're providing job training and certification to those incarcerated and connecting them to employers upon release. In the last 2 years, we've graduated over 3,000 inmates from this program. We're implementing medication for opioid use disorder and evidence-based treatment at all our DOC facilities, moving from small-scale pilots to full implementation. And we know We can do more to help people avoid returning to jail if we connect them to the care they need while they're there. And we've engaged our county sheriffs, introducing them to their community mental health providers so that no matter when an inmate is released from jail, there is continuity in their treatment. It's working in our pilot programs, so we've partnered with the Indiana Sheriff's Association to invest $4.6 million in implementing evidence-based treatment into more jails across the state next year. During my travels throughout the state, I've had the opportunity to meet a lot of people. I met an individual who spent time at the Department of Correction, and it's really a story of the system working for that person. Programs that we put in place allowed them to take additional educational and career trainings while at DOC, and when they were released, there was a job waiting for them. This individual had 2 years in recovery under their belt when COVID-19 hit. Unfortunately, after a relapse and a subsequent incident involving drug use, that person is likely going back to DOC for a considerable amount of time. It's stories like this that drive us to do the work that we do, to pick up individuals when they fall, to help them rebuild, and to let them know setbacks are okay, that there is hope, and that recovery is possible. This is why we must do all we can to begin to prevent people from even developing a substance use disorder in the first place. We know that intervention makes a meaningful difference in the lives of individuals with substance use disorders. We're attacking this epidemic at its roots, educating Hoosiers of all ages about the harm of substance use. Using a regionalized approach, we're instituting regional councils statewide to learn how we can have a larger footprint in every community, no matter the size. We're educating Hoosiers about the impact of substance use has on our families, friends, and our neighbors through Fix, Heartbreak, and Hope inside our opioid crisis. An exhibit at the Indiana State Museum is open again through next year and incorporates art, data, history, science, and technology to help people understand that no matter your circumstances, there is hope. All of this ties into the treatment infrastructure we're building, which is designed to connect all Hoosiers to the full continuum of care for any substance use disorder. I'm sharing all of this to stress that our administration has not sat by and watched the side effects of COVID-19, but rather we've taken a proactive approach. And if anything, COVID-19 has us working harder than ever to help those with substance use disorder and mental health challenges. So where do we go from here? Combating the drug epidemic continues to be a top priority of our administration, and while we've made progress, we know there is still much more work to be done. And that's where you come in. When I was invited to give this keynote, I was asked to include a call for action for 2021. And while I gave this a considerable amount of thought, because there are so many important things going on and so many efforts that need our focus, we must continue to ensure access to timely treatment. We must do all we can to make sure that people are able to find and stay in recovery. But it starts with compassion. So my call to you is simple. Be kind to your neighbors. Let us all work together to be more understanding of our fellow Hoosiers. There's a gentleman who I met in my travels who tells a story of him starting out abusing substances in college. He knew he wanted to feel better, but didn't know where to start. And after 2 years and a few setbacks, this individual finally reached out for the help he needed for so long. Stigma keeps people from getting treatment. It keeps people in the shadows and it causes shame. And it stops people from saying, I need help. Today, this individual has been in recovery for 6 years and shares his story to let others know they don't have to do recovery alone. He hopes his experience encourages others to not wait so long to ask for help. We hear stories every day of hope and recovery, and that's what keeps us coming to the office, working hard and trying to tell the story that millions of people around the country have recovered from this disease. When we have compassion, when we break down the stigma around addiction, and specifically around setbacks, the more people we'll see entering treatment and with time, achieving recovery. People need to understand that addiction is a disease. treatment is available, and recovery is possible. With your help, we'll do what we can to help keep people alive, expand timely access to treatment, and prevent others from developing a substance use disorder. I thank you all for your partnership and all that you are doing to make our state a better place for all Hoosiers. Thank you.